Hello everyone, this is Dr. Prashant Reddy, consultant physician in Renova Hospitals. So, in recent past, if we see one of the most common or the most prevalent cause of the most morbidity and mortality in India is diabetes. We India are just called as diabetic capital. So, what exactly is diabetes and how does it cause us the complications or the problems in our body, and how can we tackle it or counteract? So, diabetes is a condition in which where there is increased sugars in the body. That's because of lack of insulin in the body, or the insulin which is there is not working well. That can be due to insulin resistance or other things. So there are multiple types, but generally we take type 1 and type 2, the most two prevalent types of diabetes. We have other types also, type 3C, type 3CA, type A, B and all. We'll just focus on this type 1 and type 2 diabetes. Type 1 diabetes is a condition in which there is a defect in our pancreatic cells from where the insulin is released. So, there is a defect in the production of the insulin, leading to decreased insulin in the body, and there is an increased sugars. So, this causes increased sugars in the body, leading to type 1 diabetes. Whereas the type 2 diabetes is a condition where we see there is enough amount of insulin being produced, but the insulin is not functioning to the full capacity. That could be due to the insulin resistance or other factors. So, how can we counteract, or how can we reduce this sugar levels, and how can we decrease this diabetes, and what the treatment is? So, there are the treatment for diabetes is two types, that is non-medical management and the medical management. So in non-medical management, we go for lifestyle changes, diet management, the two main things. What exactly is lifestyle changes? So one of the most important thing that everyone misses is this sleep cycle, where we have an erratic sleep cycle leading to sleeping very late in the night, getting up very late in the morning. So this causes hormonal imbalance in the body, leads to excessive fat deposition, increased insulin resistance, in turn leading to increased sugars. And the other thing is the time at which you are taking the food. So we should make sure that we have a fixed cycle for taking the meals. And most important thing is we should finish off our dinner as early as possible. The doctor recommendations are around 7:30 p.m. in the night. So make sure that you have it as early as possible. The other aspect is the diet management. So what exactly is diet management? I think every one of us know that having more sugars will definitely lead to diabetes. So try to avoid sugars. Try to avoid any fruits or food that has high sugars. Mostly in the evenings, try to avoid all the sweets or fruits. Have fruits in the morning, which is good for the body, not only for in the sense of diabetes, but the other things. So a good balanced diet along with good sleep cycle will definitely help in counteracting diabetes. And the next thing is our exercise. So everyone asks what exercise we should do, what kind of exercise we should do. The point is you should make sure that your calories burn. So just start with a simple walking, cardio. Make sure that you do it daily for at least 30 to 40 minutes a day. And then slowly you can put on weight bearing exercise also, depending upon your age and your physical condition. So it's very important about this lifestyle modifications, diet management and exercise in treatment of diabetes, because that forms 50% of the management. It's only 50% that the medicines or any other insulin or whatever helps. 50% of the treatment in diabetes is lifestyle management, diet management and the exercises. So these are very important things that everyone with diabetes or someone who is prone for diabetes should keep them in mind, or anyone with a hereditary cause that they might end up in diabetes just should keep in mind that as early as you start in your life these changes, you will be more far away from the diabetes. The next thing comes are medical management. In medical management we have two types again. that is oral medications, that is tablets or capsules, and the other thing is the insulin. So depending upon the physical condition, their other complications, how their kidneys, liver and all these are functioning, we prescribe specific medications for the patients. And the people who are having type 1 diabetes, in whom there is no insulin production at all, we just go in for straight away for insulin as the treatment of choice. And now in this insulin also, we have multiple types, where there is a short acting type, intermediate type and long acting type. And depending upon the condition on who requires what, we just prescribe them. So my request is, make sure that you don't end up with diabetes by working out well, having a very good diet, and make sure that if you are a diabetic, just take the medicines on time, have a regular follow-ups and checkups with the doctors, and not to end up with the diabetic complications. Thank you.